It is the height of summer, and that means it's also prime time for Lyme disease, that debilitating infection spread by ticks. 20,000 people get the disease every year, and now an emotionally charged new documentary called Under My Skin looks at sufferers of chronic Lyme disease, a painful condition at the center of a heated medical debate.
It's like being wrapped up real tight like a mummy, so you can't move anything, and then having tape across your mouth, so you can't say anything.
I went from being like a gifted athlete to, there's times it's hard to put a shirt on.
I used to do ballet. I was really confused when the doctors told me there was nothing wrong with me and I was just making it all up.
Most cases of Lyme disease can easily be treated with a short course of antibiotics, but for some, their persistent symptoms are challenging the conventional medical wisdom.
I've been misdiagnosed as having chronic fatigue syndrome, lupus,
ALS to MS to nothing.
There's no medicine for someone like you. You're an attractive girl, and obviously you don't feel like you're getting enough attention.
What's going to happen to me? What's going to happen to me? I don't want to die.
Patients like these say they're suffering from an ongoing Lyme infection, but doctors hotly contest whether chronic Lyme disease actually exists. Doctors' groups are at odds over the scientific evidence here.
We want to help people who are suffering. That's our job. But our job is not to make things up just because people want answers. We look at the scientific literature and we try to guide their doctors.
There's plenty of science that supports persistence of Lyme disease. And it's a broader perspective and interpretation of the science. It means that many people who could be treated aren't, and go on to suffer chronic illness, and that could be avoided and prevented.
Further complicating the problem is that there's no reliable test which tells you if the Lyme infection is still present in the body. And doctors strongly disagree over long-term antibiotic use, which is often prescribed to these chronic patients. In clinical trials, the results have been mixed, and for some, it's been fatal.
Sometimes doing the wrong thing is worse than doing nothing. It's better to find out what's really going on and address that and treat it.
Is the risk of the disease worse than the risk of the treatment? If it is, then we want to treat. If it's not, then we don't. It does seem to help some people when you use a well-planned strategy.
And for those who are suffering, they say it's clearly worth the risk.
6 months into the Lyme treatment, it's without a doubt better. I mean, there's no question in my mind. But I feel like I'm getting back to being myself.
By the time you're so disabled by the disease, you're in a panic state. You want help, it doesn't matter. You'll pay anything to get your health back.
And so we're joined now by Dr. Marie Savard. Doctor, it's always great to have you with us. And I know that Lyme disease is detected in all 50 states, worse in some areas than in others. But where does this debate over chronic Lyme disease stand?
You know, doctors still don't fully agree, but they're doing a lot of research, and that's what's important. But the bottom line is people are suffering, and there's some people who have the continued symptoms, as we saw in the tape, and we don't have an explanation. But they're looking for a cause, maybe autoimmune, maybe a persistent infection. But they are doing the work to try to find those answers.
Excruciating for the people who think that they have it. Let's talk about the symptoms, so that if you're out there, often it goes misdiagnosed. That's the biggest problem here, is it not?
Yeah, the bottom line is it's a serious disease, so it can be misdiagnosed, it can look like other things, but the earliest sign, 70 to 80% of people will have what's called a bullseye rash, a red rash. That can be a clue. That can be then quickly followed by other things like chills, headache, fever, even fatigue, joint pains. A lot of symptoms, even swollen lymph glands. And those are the early stages, and if you get to the doctors, get on the antibiotic, it can make a huge difference. The late stage is the arthritis. It can affect the heart, can even affect the brain. So it is a serious problem and something that we have to be vigilant to. I mean, it's the most common insect type of infection that you can acquire in the United States.
And those initial symptoms that you mentioned are so common for so many different things. You can see why people misdiagnose it or let it go.
Well, first of all, you have to recognize if you've had a tick or if you're in a tick-infested area. You really have to take the precautions, because if you've removed a tick, you can have symptoms anywhere from 3 days to 30 days. That's when that red rash can develop. The rash is actually typical enough. Looks like a bullseye. Your doctor can make a diagnosis. You don't even need blood tests. They ought to get you right on antibiotics.
Okay, you talk about that bullseye rash. The symptoms that go with it come afterward. What do you do to treat it? Can it be fully treatable?
Absolutely. Antibiotics work. The earlier you start antibiotics, the better. If you have that tick on you more than a day and a half to 2 days. Ask your doctor for a single dose of antibiotics, and that can get rid of it, can prevent it. Beyond that time, you need to take at least 2 weeks and sometimes as much as a month, depending how serious and how far along it is.
You mentioned the tall grass and other areas where you should expect that ticks can be living, but what do you do in other ways to prevent this from happening in the first place?
Common sense kind of precautions. First thing, wear clothes. Long clothing, tuck in into your pants, tuck in the long, pants into the socks. Cover yourself. Check every day. Look for ticks. They're tiny little sesame seed type things. Look for them. Spray 20 to 30% DEET insect repellent if you need to. Common sense, though, don't, stay out of the grass, stay out of the ground. Don't roll in it.
Yeah, we don't want to scare people. We just want them to be aware, right?
Be vigilant and call your doctor if you have any questions. Don't wait.
Great to have you with us on The Fourth. Dr. Zavard, thanks for being here.
Great, thanks.